Hello class. This video is going to be an introductory video, so I'd like to give you a little bit about who I am, what qualifies me to teach this course, and how I go about and view my teaching philosophy. How do I like to teach my class? And we'll use this as a foundation, kind of a meet and greet video, okay? So my name is Donna Castellano. I have 35 years experience in varying degrees of healthcare administration, director of operations, administrators. I actually started at the bottom. I went in there being an administrative assistant. I became a manager of a department. I became an administrator, and then I became a director of operations. Why I really liked starting at the very bottom was that I was able to know what everybody did in their position. Actually, I started my entire career before I even went into healthcare as a file clerk. And I went from file clerk to typist to secretary to supervisor to manager to administrator and to director. And so the benefit of having that broad range of experience is once you get to manager and director and you're responsible for an entire staff, you can, number one, know how to best utilize your staff because you did most of those positions. You know how they work, how they fit into the team, and how to utilize them best. Plus, you know when people say, I don't want to do that because I don't think it's part of my job, you could say, yes, it is part of your job. And how I know that is because I did that, I did that job. So I always felt that, laying down a really strong foundation helped me. Also, I started off in the law first, and I really liked working in the law. But when I was looking for longevity, a career that would give me longevity, I chose healthcare. And I went into healthcare because my feeling was there will always be sick people, there will always be hospitals, there will always be doctors. And that's what made me into healthcare. But when I entered healthcare, literally, you had the doctor, the nurse, the patient. You really didn't have the layers and layers of technology people that we have today, of finance people that we have today, of billing people that we have today, of ethical people that we have today, of the lawyers and the government regulations. Really, honestly and truly, that was not there. So when I went into healthcare, I went in at a very simple time. It was pretty straightforward. Many places weren't even bothering to bill Medicare, Medicaid. Don't forget, they didn't come around until 1965, and hospitals were kind of lax. There was no HIPAA. So when I went into that field, it was around 1983, and I will tell you, the benefit of my timing was that I went into healthcare just at the time it was starting to change. And they had just implemented the DRG system, which is the diagnosis related group, because it was around that time that hospitals realized people are starting to live longer, and we're not going to be able to sustain our very existence unless we try to control costs. So that was the very beginning of it. And I watched it go from a very simple operation to where it actually became a corporate operation. So I would be able to write a really great book as to how one industry just totally, I'm going to say, complicated itself and just added layers and thousands of people, almost to where it is today. I would say that it's a very financially driven operation. It's all about, getting the money. And yes, you do have, wonderful clinical people, but even on their backs, hanging over their head is, we have to make sure that we watch the costs. So that is how I got into healthcare, and I think that background makes me a teacher that likes to, and not only likes to, but can enhance the books by giving you real life observations, real life anecdotes of real life people, real life doctors, real life medical centers, and how they struggled and what the reality is as to where we are today. As an instructor, I got the opportunity to teach through one of my jobs. I walked into one of my boss's offices, and she handed me a paper and said, go over to Westchester Community College. They're looking for someone to teach. And so I did. And some of the courses over my career that I've taught is everything from electronic health records, health insurance, business communications, administrative medical assisting practices, medical office administration, ethics and the law, liability and HIPAA. The course I teach now, Introduction to Healthcare, medical terminology, the culture of healthcare, design and usability factors, health insurance. I co-wrote a couple of classes on health insurance and reimbursement. As I said, that became a really hot topic in healthcare. I didn't always live in Florida. I just moved down here 5 years ago from New York, and much to my surprise and amusement almost, everyone from New York is down here. So I really do expect that Florida will be changing its name to incorporate New York and New Jersey somehow in there. So that's a little bit about my work experience and all of my teaching experience and why I'm qualified to teach this course to you. Okay, now when I consider teaching, how do you set off wanting to be a teacher? And what do you take into account when you're thinking about how am I going to teach my students? What do I want to consider here? Okay, my basic overall teaching philosophy is that I'm not teaching a subject, I'm teaching people. I'm teaching a student. So my goal is to set out and teach the whole person, okay? I want to be aware of what the student needs cognitively, effectively, and behaviorally, considering at all times that my student is a human being. Learning, I believe, is socially constructed. So I want the students to collaborate with each other as well as me. And there's only one way to do that, and that's to set up a very good community-based environment. Some of the ways I do that is that I'm always accessible. And I get back to my students right away. So no one is just out there, okay? I'm always within a click or a phone call. And I really encourage my students not to sit with something and suffer. I do not like to hear that someone was up all night because they couldn't get something. Had they picked up the phone or kicked me out an email in 2 minutes, I would give them the answer. Or we would figure out what the problem is, or I would help them with a solution. And they wouldn't be up for hours and hours and losing sleep over something that could be collaborated with, okay? So I develop a sense of community in the class, and as members of this community, I feel that my students are responsible not only to themselves, but to the other members of the community, including me. Okay, I will always encourage my students to become lifelong learners. There's a whole chapter, on lifelong learning. However, I reinforce that because I myself am a lifelong learner. And it means sharing with others what they learn and realizing all they haven't discovered. And so I want my students to become empowered by their own learning. So I present situations where students can take charge for what they learn and how they can apply it in careers. I went to school for a very, very long time, and I was able to take what I learned in class at night and apply it on the job the next day. I could go to my boss, I could go to different people and say, why aren't we doing this? Why aren't we doing that? And incorporating many of the things that I learned. And I believe that's really very well received at work, okay? And so I think that it's a good way to instill in students, become a lifelong learner. So my goal with each of my students is to help all my students, okay, realize the potential that they possess to make the best use of their mind and hearts and those behaviors which make the world a better place. Because it doesn't matter how important we are, it doesn't matter how smart we are. We don't want to be so removed from everybody else, okay? That doesn't make the world a better place, okay? That just keeps everybody distant and not interacting with each other, and the world can't become a whole. So I like to try to help the student find the way that through their minds, hearts, and behavior, they can make the world a better place, because you really can. It doesn't have to be on a grand scale. It could be on a very small scale, and it could be on a person-to-person scale. But it's always surprised me that people have come back to me and said, that they thought about something that I said to them when they were, choosing a job or something they were doing on the job. And they will contact me sometimes years later and say, I was doing this and I thought of this because you said this. And so over 18 years, even if it was only one person a year, that over 18 years, that's 18 people. So that's really the way to go. So when I set out to teach each class, I recognize that each class is made up of different people. I do try to take a look at who my group is, and if I need to make adjustments to what I'm trying to teach, I do that as well, recognizing that there's not one cookie cutter way to teach something. And, every day we're finding out new ways of a subject. Like healthcare is still one of the most fluid environments there are. It's not finished being changed. For the longest time, it was all about, keeping the patients alive. Now it's more about let's be preventive and let's keep our patients well. And at the same time, we have to be aware of the costs, and the insurance, who pays for this, is still changing. So every semester, there's something different to say about this course. But I love this particular course. I love this particular course because I look at it as if it's an introduction, like we're on a vacation and we're going around and we're sampling and we're looking at things in a very broad way, because we're not here for a very long time. So we're going to look at each aspect of healthcare, because I'm introducing this topic to you. Many of you have never been in healthcare, many of you have, but each week we're going to be looking at a different topic, a different segment of healthcare. So that keeps it diverse, that keeps it extremely interesting. And we're looking at it in such a broad way that we're not getting bogged down with too many details. And so you can get an overview, if you will, of all the chapters. And I think it's, 12, 13, 14, 15 chapters that we're going to be looking at over the course of this semester in the broadest sense. So you get a flavor of what it's like. So, I welcome you to this class. It's an introduction to healthcare, and I hope that this video has helped you to meet me and know that you're in good hands. I know what I'm talking about, and I've been around in healthcare a very long time. And I look forward to this semester like I do every semester, and I welcome you to my course. Goodbye.